morning, everyone. Welcome to today's HHS Town Hall for April the 4th. We'll begin in just a moment. Want to leave a couple of minutes at the beginning for everyone to log on. Make sure that everyone that is able to join us today has audio up and is ready for the updates. We're glad for those of you that could join that you're here today to hear the updates. We've got a good agenda. And of course, today's town hall will be recorded and made available on the hub. So if you learn something that you think your colleagues should also listen in and review, then you can put it to them to look that up on the hub. Okay, well, a little housekeeping as we begin. Our question and answer Q&A function will be open today, so you can type questions that you have in the Q&A function, and our panelists and subject matter experts will respond as quickly as they're able, and their answers will stack up in the answered tab in the Q&A function. So please ask that you put your questions in the Q&A function. We'll reserve our chat function for celebrations, which will occur at the end of our agenda. We'll have a few minutes for you to either type a celebration into the chat function and we'll read it aloud, or you can raise your hand and of course give your celebration or shout out live. So think throughout the presentations. Number one, questions. Number two, anything that comes to mind that you'd like to celebrate or remark upon with respect to your colleagues, teams, or accomplishments in the organization. So that's the housekeeping for today, and I'll hand things over to our President and CEO, Rob McIsaac.
Thank you, Aaron, and good morning, everyone, and welcome to our regular monthly town hall. As always, I'll start by acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We respect and recognize the presence and stewardship of all Indigenous peoples as keepers of this land. So I have to say, today's town hall is bittersweet for me because it's my last one as president and CEO. I'm going to save my remarks for the close of the meeting, and we'll dive straight into our regular business. And I'll ask Sharon Pearson to provide us with an update on hospital operations. Sharon, over to you.
Great. Thanks very much, Rob, and a bit of a light update today. If you could go to the next slide. Fortunately, we're through that flu season for the most part. So you can see on this slide, we see that moderation of our vacancy across most of our sites. We are still pressured at the West Lincoln site. We have seen sustained pressures at McMaster Children's. I'll talk about that in a minute. And we're seeing some creeping occupancy numbers in our ICU as well. If you could go to the next slide, please. In terms of what's affecting the occupancy rate as far as having an impact, the ED volumes are much like pre-COVID across most of our acute sites, but they're about 10% higher in the pediatric site. We are seeing that reduction in not only respiratory related visits, but also admissions to the hospital. And then consequently, we're seeing fewer outbreaks. What we are seeing is a rise in the arrival of ambulances across all of our sites, though, but overall not affecting our volumes. And then lastly, what's contributing to a bit lower occupancy is we are seeing a bit lower numbers in our ALC. I believe they're in the 230 range today. And if you recall from previous town halls, we can be up in the 260 to 270. So that's helping lighten our capacity as well. As I noted, pediatric ED volumes have sustained at a higher rate than last fiscal year. Looking at March, we know our inpatient volumes have been about 20% higher, and also seeing an increase in volumes in our labor and delivery of about 10%. So McMaster Children's site is pressured, but Bruce is going to talk about some great investments in McMaster Children's in a few minutes. And then from a surgical capacity perspective, there's been such inordinate work over the course of the last really year and a half as we've come out of COVID to return to those pre-COVID surgical levels, which we have at the Juravinski, getting very close at the general site and the other sites as well. So thanks to the perioperative and a number of other teams for all the work to get us back to that state again. Next slide, please. From the measles update, we don't have Dominic here today, but just a a couple of comments, and you would have heard this in the media, that the province is certainly seeing numbers that are a little bit higher than we would have saw in previous years. We are very attentive to that across all of our sites. There's been teams working on enhanced screening protocols, not only in the ED, but within the ambulatory areas. And we are part of a larger working group within the city with public health and our partners at St. Joe's too. So lots of work and attention so that we're prepared. Next slide. And just, I know I talk about the satellite each time, so we will remain open at the satellite health facility for this upcoming year. Lots of work to advance that facility and advocacy for ongoing sustainability of the satellite as well. We are seeing some moderation of our vacancies across all of our sites, so that's really good news. There are a few pockets for sure, and some disciplines that were inordinately challenged, and lots of work to address those pressures that we have. Great news in terms of a response to a hiring event, a virtual event that Erin's team has been coordinating with over 700 applicants. So that is music to everyone's ears. And really as a result of a lot of great work, but also a very enhanced and extensive marketing campaign that you can see about our city on social media, on the buses, the GO trains, websites, etc. So many thanks to the HR team, because it's been an inordinate lift to put this campaign in place. And just some good news that came from the budget last week. We have a number of initiatives that are supported by one-time funding from the ministry for various programs to support nursing education and other discipline education. So the enhanced extern program, the internationally educated nurses, the NGG, the supervised practice partnerships, clinical scholars. There's a host of programs, and HHS certainly has been capitalizing on those programs to support our new hires, but also training our existing staff. So lots of great news in the HHR realm today. And with that, I'll turn it back to Erin.
Yeah, thanks very much, Sharon, for the update today. I think next up on our agenda, we have Bruce Squires, who's our president at McMaster Children's Hospital and also our vice president for Women's and Children's Health. We've been having some growth at McMaster Children's Hospital. Bruce, you're going to give us the lowdown today. What do we need to know?
Oh, yes, we have, Aaron, and thanks so much for this opportunity again, folks, to really keep you up to date on this major project. It's a major corporate HHS project, but really as well, it truly is transformational for McMaster Children's Hospital. And you know that because I've updated you a few times that we've had a very large team from within the Children's Hospital and with partners from across all of HHS who've been working pretty diligently for now 9 months to operationalize the nearly $50 million in new ongoing operating funding that the provincial government has provided to us. We're using it to implement 20 plus separate improvement projects, all focused around enhancing access to care for children and youth that we serve. Access defined as more timely and certainly of highest quality and where and when it is required. Just a couple of the kind of the key updates that I wanted to provide today. First of all, probably the most exciting is you can see we're approaching 100% of the 300 plus new roles having been filled. And in this economic environment, certainly and this labor force environment, that was a tall order. And yet we've come together with all sorts of new programs implemented by our human resources team, centralized recruiting, but also really aggressive marketing and advertising initiatives. And again, so we're really getting close to having filled all of those positions. Well, ultimately, what has that meant? Well, I like to refer to it as what a difference a year has made in our experiences. And some examples here. We've actually had more, as Sharon described, more ED volumes this year than last year, and last year was such a record year and so concerning. And yet, despite even more volume, we've seen really great improvement across really all the measures of timeliness and quality in the emergency department, for example. And, you know, the best examples are how long it takes for an admitted patient to get up to the floor, how long is the time to the physician initial assessment. And so we've improved on all of those, gone in the positive direction, despite the fact that we're seeing more volumes than ever before. And again, you can see the rapid assessment service was part of that in the emergency department, where low acuity children and youth could be seen more quickly in a different way with additional professionals. We've also, despite continued HHR challenges, started to turn the corner on the very significant pediatric surgical wait lists that our kids and youth were experiencing. We're highest in the province by far in terms of the numbers that were waiting out of window, but that's for the first time in February, and now into March started to turn. And again, that's the product of our same day overnight unit, the opening of new beds in our level 2 PICU, as well as on the inpatient surgical floor, the addition of some really innovative block scheduling strategies, including the use of a Saturday case dedicated solely to long waiters. And as I said, we're starting to turn the corner now and bending that curve. And as we're successful in recruiting new physicians, which we hope will come with our alternate funding plan approval, we're still waiting on, but hoping for, that will really allow us to drive down those wait times. And then this year we were able to maintain all of our ambulatory activity, not having to divert, in some cases redeploy those staff to support inpatient and emergency department volumes. They stayed focused on ambulatory activity, and in fact we implemented after hours clinics through this surge. And you know, the result of all that is we've got a 16% increase in our ambulatory volumes. And again, that's while we've been recruiting new folks. Next year, we're going to have them all in place, so expect even greater results. Those are just some of the real highlights we wanted to share now. But if you've been watching Share, you've been watching the Hub, you've been watching social media, you know that the team has been rolling out success stories, innovations across, again, the entirety of the programs over the past few months, and that's going to continue right through until the summer as we share what a difference in this investment has made and will make going forward. If we go to the next slide, I wanted to talk about another really exciting piece that's certainly linked to growing MCH. If you go back, you know, more than a decade, one of the really significant remaining gaps that existed in this region, even with the introduction of McMaster Children's Hospital, related to the accessibility and quality of care for pediatric palliative care. So care for children experiencing and families experiencing life-limiting conditions for those children. And one big piece of that was recognized by our teams and by the community was the absence of a pediatric hospice. As a result of that, and really the vision of folks like Rob and Peter Fitzgerald and so many others, we began Master Children's Hospital and HHS to partner with Dr. Bob Kemp, the leading provider of hospice services in the region, to begin to envision what was possible here and envision really the difference that we could make in that most difficult situation for families. And I'm so happy and pleased to announce that again, our partnership with Kemp Care Group has now progressed to the point where we have land provided by the City of Hamilton. Thank you to them. We have significant investment by the province in a regional pediatric palliative care team based out of HHS, and we have a upcoming groundbreaking ceremony at 41 South Street West in Dundas. That we understand the Premier and the Minister's Health will likely join, and that will be when we're going one step further to towards a pediatric hospice here in Hamilton and serving our region with a launch date looking like spring of 2026, and that's a really exciting and important development for this entire community and region. And again, you know, I'll use this chance as to just point out to Rob that that's one of, I think, the many legacies that you can take pride in as you move on to your next stage of your career. So with that, thanks very much, Aaron. I'll turn it back to you.
Yeah, thanks very much, Bruce. A lot going on to be proud of for sure, and a great update today. Next up on our agenda, we have Kelly Campbell, who's our Vice President of Corporate Services and Capital Development, to talk about more redevelopment, more growth happenings. Kelly, what do we need to know?
Yeah, great. Thanks, Aaron. Lots going on, and many of the staff on the call today will have participated actually at the Dravinsky site in just this past January. We submitted our functional program for the continued redevelopment of that site to the Ministry of Health. It's a significant plan that outlines all the new services, space, and resources that we need in the future at that site. It was a significant milestone to get this work done and was informed by hundreds of staff and physicians through the course of 2023 and early 2024. We anticipate the ministry feedback and approval on that submission late this year or early 2025. We did find out that Infrastructure Ontario, along with many other active projects in the province, has delayed our project a little bit due to resources and load leveling for the contractors involved in these big hospital projects. That extended the JH project by about 15 to 18 months. So as it stands today, given our current timelines and assuming ministry approval and funding, we would plan to start construction around 2028. And that would be almost a 10-year construction, given the 3 phases of demolition, build, that we'd have to complete. In terms of how we're going to pay for Dravinsky, we've been meeting with the Hamilton City Council and staff since early 2023 to look at potential funding options for the local share that is a part of every ministry project. Unfortunately, Council decided not to make a commitment in its 2024 budget, but we're continuing to work with them and obviously are very hopeful that this will go into a subsequent year budget and will over time start to fund the local share that's required. Switching gears to our West Lincoln site, which is well under construction as scheduled. The structure is complete for those that have been at the site lately. Cladding's going on the exterior, the roof is going on, so the site will be watertight by next week, and significant interior progress is starting. So it's very exciting to see that structure rise out of the ground. We are working with the 3 local municipalities and exploring community interest towards actually changing the name of the hospital to West Niagara Memorial. This is largely driven right now by municipal leadership and the foundation, but community engagement is important in this decision making. So we're doing some work now and hope to bring a recommendation to our board in May. So that's the highlights from a redevelopment perspective. Turning it back to you, Aaron, I think.
Yeah, thanks very much, Kelly. That's a fantastic use of orange tarps. And
There you go.
right there. But a beautiful building coming up for sure. For those that have the chance to drive by that site and take a look, you'll notice a very big change going on. So that's great to see. Okay, so we have had our Q&A function open. We haven't had any questions yet, but just a reminder to everyone that you can continue to enter questions until we're done. Today, we'll make sure that we get you an answer. You can also email hhsnews@hhsc.ca. Should something come to mind that you didn't ask today, but wish to ask later, you can always use that forum to pose questions. and we'll get an answer to you. And if it's something that deserves addressing in this forum, we'll take that under advisement too. Okay, so next up, I believe we have our celebrations. And so you can certainly type your celebrations into the chat function, or you can raise your hand and give your celebration live. And maybe as I have the microphone, I'll use the opportunity to call out the occurrence of National Volunteers Week on the horizon beginning on April 14th. And just to say to everyone in the organization, if you have a chance to thank a volunteer during that week, they perform a really remarkable service to Hamilton Health Sciences, and I would encourage you to do so. And I will say, as I won't have the opportunity before National Volunteer Week, thank you to all of our volunteers across the organization. We're almost back to 900 volunteers now in the organization, and a distinct thank you as well to our volunteer resources team for coordinating the involvement and participation of volunteers in the running of the hospital. It's a great contribution. I see some hands coming up already. Patty McEwen. Patty, what would you like to celebrate today?
Just wanted to celebrate the HHR successes that have been discussed today. So the nursing fair, the growing MCH, there's lots going on. And I think that we all knew that these HHR challenges weren't going to be easy to fix or quick to fix. And it's nice to finally be seeing a bit of a turnaround and years of work actually yielding good results. So I just really wanted to celebrate both the team, the recruitment and talent management team, and all the other teams within HR that help support that, and the excellent partnerships we've established with leaders and staff out in the organization to really help make that happen.
Yeah, for sure. Great work going on there. Thanks for raising it. Tim Dietrich, you've got a hand up. What would you like to celebrate today?
Yeah, thanks very much, Aaron. I'd like to celebrate the teams and team that's come together from across HHS to prepare for our measles response. Amazing participation and lots of work done by our operational leaders across ambulatory, ED, urgent care, acute inpatient, perioperative, obviously special call out to our IPAC team, our physician leaders, Dominic and Sarah, and our infection prevention and control practitioners, dealing with a very busy outbreak season through the viral season, and then having to turn on a dime and help prepare for the measles response. Our lab and pharmacy teams, our physician leaders across the organization, and particularly in peds ambulatory, pediatrics as well, and our ED physician leaders. Our EPIC HITS team has come together, our clinical informatics specialists, to really help us prepare within EPIC around screening, et cetera. Our communications team, education, health, safety, and wellness, EDI, and human rights. You can see the list goes on, and just want to thank everyone for coming together and helping us prepare in the event that it does ramp up.
Yeah, thanks, Tim, for remarking on that for sure. Leslie Gillies, you have your hand up. What would you like to celebrate today?
Thank you to Andrew Mall and his leadership in preparing all of us for the solar eclipse on April 8th. And thank you to all the site director leadership of their work, working with their teams of staff and physicians and other leaders in preparation for Monday.
Thanks very much, Leslie. So I'll just read out a few here in our chat function from Mike Campen. April 14th to 20th is also National Medical Laboratory Week. So thank you for raising that, Mike. From Tasha Marzilli, echoing Sharon's thoughts, very grateful to the central recruitment team who are facilitating the nursing career fair and the 700 registrations received. Thank you. From Morgenstern, best of luck to Rob McIsaac in his future endeavors. Thank you for that. For Rebecca Salerno, a big welcome to Emma and Michelle joining the centralized recruitment team. From Aaron Hatcher, question on what the plan is to deal with the parking issue. Oh, parking issues at Mumsy. Great question. We'll put that into the Q&A function, Aaron, and try and get you an answer from our team Mike Campen again, April 16th is Advanced Care Planning Day. April 24th is Admin Professional Day, and April 29th to May 3rd is Cardiovascular Perfusion Week. Mike, I'm starting to get the sense that maybe you've got a calendar going, but that's great. Thanks for remarking on all those. It's important that everybody knows what's going on across all those important roles in our organization. From Tammy Packer, I'd like to celebrate and acknowledge the never-ending compassion, commitment, and empathy that our patient experience team shares every single day and night, in caps. Thanks, Tammy, for that. From Colleen Anderson, echoing Patty's comments about the amazing work of HR to recruit all the new staff. Thank you very much. And Kate Daly showing a little love for communications and public affairs. Well, I know it's worked very hard as well on the recruitment marketing out to market. It's a remarkable thing that we can have all of that creative executed internally at HHS without having to hire outside help for that. Some very talented and creative people in our midst. From Amy McKenzie, thank you to Rob for all his hard work and dedication to healthcare at Hamilton Health Sciences. From Holly Augerman, this week we celebrate World Autism Day and the beginning of World Autism Month. This is a time to focus our efforts on raising awareness, promoting acceptance, and advocating for a world in which autistic individuals and their families can thrive. Would also like to celebrate our autism team for all they do to support our patients and families. From Deanna, the autism program is celebrating the successful silent art auction at Ron Joyce Children's Health Center on Tuesday for World Autism Awareness Day. Thank you to everyone who participated and donated. From Tasha Marzilli, huge thanks to the CEO Onboarding Working Committee working to prepare for Tracy MacArthur's first day and beyond, for sure. From Patiba Harsha, thank you, Tim, for leading the measles work. From Jenny Probra, celebrating our amazing oncology nurses on National Oncology Nursing Day from Tuesday. Delia Palmer, interprofessional practice chief, led the planning for the day and put on a great event. Neil Johnson, I'm sure, and his oncology program went above and beyond to acknowledge and celebrate our oncology nurses on that day. Thanks to everyone for your hard work. Great stuff. From Winona Smoke, thank you, Rob, for your commitment to Indigenous cultural safety. Best of luck. Another from Jenny Proba. The Nursing Excellence Award nomination period has been extended to Tuesday night at midnight. Please consider nominating a deserving nurse and nursing team for these awards. Really important, for sure. Thanks, Jenny. From Kelly Turner, congratulations to the Hospital Elder Life Program HELP team on 20-year anniversary of HELP at HHS. That's fantastic. Well, that's a really rich set of celebrations. And one question, which we put into the Q&A function for sure. Maybe I'll close just by giving a last congratulations and thanks, Rob, to you celebrating your 10 years at Hamilton Health Sciences as our president and CEO, and of course, your last town hall. Maybe we'll put it to you for some final thoughts.
Yeah, thanks very much, Aaron, and thanks everyone for the generous comments. Maybe I'll close with one final celebration, and it's really a celebration of everyone at HHS and all that we've accomplished together over the last 10 years. Shortly after I joined HHS, I set out on this journey of trying to observe three guiding principles: making sure everybody in the organization felt valued and respected, helping everyone to understand how they actually played an important role in us achieving our vision and mission, and also trying to make sure that people had the right tools to do their jobs. So no doubt there's still lots of work to do on each of these things, but I'm still really proud of the progress we've made together in this time. I think our collective accomplishments are a testament to our shared commitment to this community and to this region that we all, I think, care about so much. But I think what's impacted me most during my time here is sort of the unwavering mission-driven spirit of the people who work, practice, learn, volunteer here at HHS. I think the response of all of you to the challenges that have faced us this past decade, especially during the pandemic. Really revealed the depth of your collective resilience, your courage, your compassion, and your commitment. So as I transition from my role, I do so with a lot of optimism for the future of Hamilton Health Sciences. I think this organization's best days are just ahead, and I think it's poised to achieve a lot of remarkable things. I sincerely hope that you are as generous to my successor as you've been to me. And if you are, I know she will do great things. So with thanks and gratitude, I'll sign off for the final time. Cheers, everybody.